two important landmarks, the anatomical neck and the surgical neck. The anatomical neck is the narrow groove immediately below the head of the humerus, marked in green. It separates the articular surface of the humeral head from the greater and lesser tubercles. This region represents the attachment of the joint capsule of the shoulder and plays a key role in forming the glenohumeral joint. The image shows the greater tubercle of the humerus, a prominent bony projection on the lateral side of the proximal humerus. It serves as an important attachment site for rotator cuff muscles supraspinatus, infraspinatus, and teres minor, which help stabilize and move the shoulder joint. Damage or inflammation around this area can lead to shoulder pain and restricted movement. The image demonstrates the attachment sites of rotator cuff muscles on the greater tubercle of the humerus. The supraspinatus attaches to the superior facet, the infraspinatus to the middle facet, and the teres minor to the inferior facet. These muscles play a key role in shoulder stability and movements such as abduction and lateral rotation. Injury to this region can compromise shoulder function. The lesser tubercle serves as the insertion site of the subscapularis muscle, which is one of the four rotator cuff muscles. This muscle helps in medial, internal, rotation and stabilization of the shoulder joint. Between the greater and lesser tubercles lies the intertubercular, bicipital, groove, through which the tendon of the long head of biceps brachii passes. Clinically, the lesser tubercle is important because injuries or fractures involving this area can affect shoulder movements, especially internal rotation, and may disturb rotator cuff function. The subscapularis muscle is one of the four muscles of the rotator cuff. It arises from the subscapular fossa of the scapula and inserts into the lesser tubercle of the humerus, as shown in the image. This muscle plays an important role in medial, internal, rotation of the arm and helps to stabilize the shoulder joint by holding the head of the humerus in the glenoid cavity. The subscapularis is supplied by the upper and lower subscapular nerves. Proper functioning of this muscle is essential for smooth shoulder movements and strength. Clinically, injury or weakness of the subscapularis muscle can lead to difficulty in rotating the arm inward and may cause shoulder instability. Intertubercular groove, bicipital sulcus. It is a vertical groove on the upper humerus, arm bone, between the greater and lesser tubercles. Backhand index pointing right. Its main function is to hold the tendon of the long head of biceps brachii in place. Backhand index pointing right. It also gives attachment to muscles like pectoralis major, latissimus dorsi, and teres major. Crest of greater tubercle, lateral lip. Insertion of pectoralis major. Crest of lesser tubercle, medial lip. Insertion of teres major. Floor of groove. Insertion of latissimus dorsi. Easy mnemonic, PLT. Pectoralis, latissimus, teres. Borders. Anterior, starts at the greater tubercle, divides the front into two halves. Medial, runs down the inner side, ending at the medial epicondyle. Lateral, runs down the outer side, ending at the lateral epicondyle. Surfaces. Anterolateral, between the anterior and lateral borders, outer front. Anteromedial, between the anterior and medial borders, inner front. Posterior, between the medial and lateral borders. The deltoid tuberosity is a rough, V-shaped area located on the lateral surface of the middle of the humerus shaft. Its primary anatomical function is to serve as the point of insertion for the deltoid muscle. This attachment allows the deltoid to pull on the bone to abduct, flex, and extend the arm. Positioned just above the radial groove, it is a key landmark for identifying the midshaft of the bone. Physically, it appears as a distinct elevation or bump on the outer side of the humerus. The humerus shaft features key landmarks for muscle attachments. Deltoid tuberosity, a rough, elevated area on the lateral surface that serves as the insertion point for the deltoideus muscle. Crest for triceps, a ridge located on the posterior/lateral aspect of the upper shaft. Triceps brachii, lateral head. This muscle originates from the crest located above and lateral to the radial groove. Functional layout. The triceps origin sits superior to the deltoid insertion on the lateral side of the bone. Deltoid tuberosity, a lateral elevation for the insertion of the deltoid muscle. Radial/spiral groove, a shallow depression on the posterior surface for the radial nerve and profunda brachii artery. Olecranon fossa, a deep depression on the posterior distal end that receives the ulna's olecranon process during elbow extension. Lateral border, a distinct ridge on the outer side of the shaft ending at the lateral epicondyle. This image highlights the distal, lower, anterior features of the humerus. Capitulum, a rounded lateral eminence that articulates with the head of the radius. Radial fossa, a small depression above the capitulum that receives the radial head during elbow flexion. Coronoid fossa, a medial depression that accommodates the coronoid process of the ulna during flexion. Joint function, these structures allow for the hinge-like movement and rotation of the forearm at the elbow. This image displays the distal end of the humerus and its articulation with the forearm bones. Trochlea, a pulley-shaped medial surface that articulates with the trochlear notch of the ulna. Medial epicondyle, a large, prominent projection on the inner side, it is a major site for muscle origins. Lateral epicondyle, a smaller projection on the outer side, located above the capitulum. Articular surface, the combined area, trochlea and capitulum, where the humerus meets the radius and ulna to form the elbow joint.